Welcome back. Good to have you along. As always, you're watching Ozarks Tonight. I'm David Oliver. It's been a little more than 4 months now since COVID-19 became a new part of our reality in the Ozarks. And the Springfield-Greene County Health Department has been certainly at the forefront in that time, alerting us to possible exposures and helping educate us about safe ways to prevent the spread of the disease. Health Department Director Clay Goddard is joining us here on the broadcast tonight for an update on the situation with COVID-19 and a look ahead. Mr. Goddard, I appreciate your time. Thanks for joining me here.
Oh, delighted to be with you, David. Thank you.
Well, certainly we're glad you're here. It's June 25th. Let's begin by just kind of a general update for us on where we are today in terms of our response to COVID-19 from your perspective, current infections, and also prevention efforts here in Springfield and Greene County.
So we currently sit at 245 cases, and we've seen, some steady case growth. But really, to put it in perspective for you, David, if you look at us compared to other counties in the Midwest with cities of over 100,000, we are the lowest disease rate per 100,000 of any of those cities. So comparatively, we're doing quite well. We do have an interesting trend going on, however, in Missouri, where we've really seen almost a flip in the epicenter of this disease, going from more of an urban-centric disease to a rurally driven disease. And that is really maybe best exemplified by what's going on in the Joplin area, which is really one of the hot spots nationwide right now.
We actually did some reporting yesterday as far as Taney County also seeing some concerning spikes that health officials there are monitoring. Let me ask you about some news that happened today. The City Council here in Springfield talked at its noon meeting today about the possibility of even the idea of talking about requiring masks here in our city. Clearly we had a pretty good case study here locally in terms of the effectiveness of masks, despite what anybody says in terms of the Great Clips outbreak. 140 people exposed, nobody got it because they were all masked. Where do you stand on the idea of the city talking about the possibility of making masks a requirement?
Well, it's very, very clear that from a clinical and from a purely public health perspective, this is a good intervention. It has a mitigating effect on disease spread and should be a part of a bigger strategy to control the spread of this condition. That said, it is a politically charged issue. So if you're strictly looking at it through a public health lens, it's a good strategy, but you have to understand that there is going to be, unfortunately, some political controversy that follows those types of efforts.
Clay, we're seeing cities and governments relaxing rules right now on mass gatherings, allowing for some gatherings to take place with some capacity restrictions. We have that here in Springfield, I know. Where do you stand on the issue of us kind of getting back to some semblance of mass gatherings? Are outdoor gatherings safer than indoor gatherings? What are your thoughts?
Yeah, there's no doubt that outdoors is going to be safer than indoors. You eliminate that recirculation of air. But really it all boils down to, David, that density and intensity equation that I've talked about at some length. We really don't need people gathering together in large numbers very close together and spending a significant amount of time together. That's a perfect environment for this disease to spread. And so that's why we have some density restrictions. I will say this, though. We're not going to be able to hermetically seal ourselves away from the world. And we're going to have to figure out a way to coexist with COVID-19 for a while. We think that wearing a mask in those settings is also very important. And please remember, if you fall in one of those high-risk groups, it might be best just to put that practice of gathering together away for a while. Try to find some alternatives to doing that.
Let me ask you about nursing homes. We get a lot of calls here in our newsroom. I'm sure you all get them at the health department as well. People asking about the potential to relax some guidelines in terms of visitors, to allow families to see their loved ones again. Where do we stand on that right now? And maybe you could talk about why nursing homes are of greater concern.
I have friends who have parents in these settings, and it has been incredibly emotionally taxing on them and their loved ones to be held apart like that. Now, we do not, as a local public health department, regulate those settings, but the state health department does through their division of licensure, and they are working on some protocols that will start to relax those approaches. I don't know exactly when those will be available, but I've heard for a couple of weeks that they're very close.
You know, yesterday your office put out 2 different public notifications in terms of potential public exposure. Let me ask you to talk about why that is important that you put that information out. There are people out there who would say, well, you don't do that for the flu or the common cold. Why is this different? Maybe you can explain to folks again why this is different.
Well, this, number one, is much more infectious than the flu. Number two, we have no intervention. There's no antivirals that are effective. There's no vaccine against this. And think about it this way, David. We've had 961 deaths in Missouri, even after taking an unprecedented approach to with stay-at-home orders and those sorts of things. So this is a very concerning condition. And one thing that we decided to do very early on was to be as transparent as we possibly could be as a public health department. We know that those exposures are relatively low risk, but there's not a situation where there's no risk involved. And we want people to have the opportunity to have that information if they wish. Additionally, I think it's a good reminder that this virus is still with us. And I fear that people have psychologically started to be done with this condition. I can assure you that this virus is not done with us, and it is going to continue to look for vulnerabilities, including our behaviors becoming less on guard until we get to that vaccine or those therapeutic medications.
All right, Health Department Director Clay Goddard, we're running out of time. I wish I had more time tonight. I could listen to you talk about this quite a bit more, but we'll invite you back again. I appreciate your time this evening, sir.
Oh, thank you, David. I appreciate the opportunity. Anytime.
Okay. We'll have more Ozarks Tonight after this quick break.